Hi again, this is Lance Capel. This is Grand Canyon University. This class is Bio 520, and this is the Cardiac 2 presentation and blood. The topic that I chose to do my presentation on is erythrocytes, blood types, and transfusion reaction. Erythrocytes, red blood cells, are specialized cells. They're responsible for transporting oxygen from the lungs to tissues throughout the body and carrying carbon dioxide back to the lungs for exhalation. They are disc-shaped cells without a nucleus, which maximizes their surface area for gas exchange and also allows them to flow smoothly through the blood vessels. The basic feature of bioconcave structure is that it has more surface area than the flat surface. Thus their bioconcave shape gives the blood cell a larger surface area, which increases the ability to absorb oxygen. Red blood cells have very thin cell membranes. This lets oxygen diffuse through quickly. The cells themselves are thin, so there's only a short distance for the oxygen to diffuse to reach the center of the cell. The bioconcave shape provides a large surface area compared to the volume of the red blood cell, allowing diffusion to happen efficiently. Red blood cells do not contain a nucleus, so they contain more hemoglobin. Oxygen combines with hemoglobin to form oxyhemoglobin. Next, we're going to talk about hemoglobin, oxygen transport, carbon dioxide transport, production and regulation, lifespan, and then role in cardiovascular health. So, with hemoglobin, erythrocytes contain hemoglobin, which we discussed earlier, a protein that binds to oxygen in the lungs, and it releases it in tissues with lower oxygen concentrations. Each hemoglobin molecule can carry 4 oxygen molecules. Oxygen transport. Erythrocytes pick up oxygen from the alveoli in the lungs, where oxygen concentration is high, and deliver it to tissues with lower oxygen levels, such as muscles during exercise. Carbon dioxide transport. As erythrocytes deliver oxygen to tissues, they also pick up carbon dioxide, a waste product of cellular metabolism. Carbon dioxide is transported back to the lungs, where it is exhaled. Production and regulation. Erythrocytes are continuously produced in the bone marrow through a process called erythropoiesis. The production of erythrocytes is regulated by the hormone erythropoietin, which is released by the kidneys in response to low oxygen levels in the blood. Lifespan. The average lifespan of an erythrocyte is around 120 days. As they age, erythrocytes become less flexible and are removed from circulation by macrophages in the spleen and liver. Lastly, the role in cardiovascular health. Adequate levels of erythrocytes are essential for maintaining cardiovascular health. Anemia, which is characterized by a decrease in the number of erythrocytes or hemoglobin levels, can lead to symptoms such as fatigue and shortness of breath. Conversely, conditions like polycythemia, marked by an excessive increase in erythrocyte count, can also increase blood viscosity and strain the heart. Next, we're going to dive into blood types. Blood types are determined by the presence or absence of specific antigens on the surface of red blood cells. The main blood group systems are ABO system and the Rh system. The ABO ABO blood group system. This system classifies blood into 4 main types based on the presence or absence of 2 antigens, A and B. Type A. Type A has antigens on the surface of the red blood cells and antigen B antibodies in the plasma. Type B has B antigens on the surface of the red blood cells and anti-A antibodies in the plasma. Type AB has both A and B antigens on the surface of the red blood cells, but no anti-A or anti-B antibodies in the plasma. Type O has neither A nor B antigens on the surface of the red blood cells, but has both anti-A and anti-B antibodies in the plasma. And Rh blood group systems. This system classifies blood based on the presence or absence of the Rh antigen, also known as Rh factor or D antigen. Rh positive. This is the presence of the Rh antigen on the surface of the red blood cells. Rh negative, which is the absence of the Rh antigen on the surface of the red blood cells. Next, we're going to discuss the significance in cardiac physiology. Blood types are crucial in various medical procedures, including blood transfusions and also organ transplants. Before a blood transfusion, it's essential to match the donor's blood type with the recipient's blood type to prevent transfusion reactions, which I'm sure most of us have heard about. Mismatched blood types can trigger immune responses, leading to potentially life-threatening reactions. Organ transplants. Blood type compatibility is also critical in organ transplantation to reduce the risk of rejection. For example, when transplanting organs like kidneys or livers, matching the donor and recipient blood types can improve the chance of a successful transplant. And with blood transfusions, before blood transfusion, it's essential to match the donor's blood type with the recipient's blood type to prevent transfusion reactions. Mismatched blood types can trigger immune responses, leading to potentially life-threatening reactions. Organ transplants. Blood type compatibility is also critical in organ transplantation to reduce the risk of rejection. For example, when transplanting organs like kidneys or livers, matching the donor and recipient blood types can improve the chance of a successful transplant. Explanation of transfusion reactions, a significant aspect of cardiac physiology. Transfusion reactions occur when blood from a donor is incompatible with the recipient, leading to adverse effects. These reactions can range from mild to severe, and in some cases they can be life-threatening. And then here are the different types of transfusion reactions. First, we have the acute hemolytic transfusion reaction. This is the most severe type of transfusion reaction and occurs when the recipient's immune system attacks and destroys donor red blood cells. It typically happens due to ABO blood group incompatibility, where the recipient's antibodies recognize the donor's red blood cells as foreign and mount an immune response. Symptoms can include fevers, chills, chest or back pain, hemoglobinuria, which is the presence of hemoglobin in urine, hypotension, and even disseminated intravascular coagulation. Next is febrile non-hemolytic transfusion. This reaction is characterized by fever and chills during or shortly after a transfusion and is caused by the recipient's antibodies reacting to donor white blood cells or cytokinase present in the blood product. Febrile non-hemolytic transfusion reactions are typically mild and self-limiting, but they can be distressing for the recipient. Next is the allergic transfusion reaction. Some individuals may experience allergic reactions to components in the transfused blood, such as plasma proteins or preservatives. Symptoms can range from mild itching and hives to more severe reactions like anaphylaxis, which can be life-threatening. Transfusion-related acute lung injury. This is a rare, but it's also a severe reaction characterized by acute respiratory distress occurring during or within 6 hours of a transfusion. It is thought to be caused by antibodies in the donor blood reacting with the recipient white blood cells, leading to inflammation and capillary leakage in the lungs. Transfusion-related acute lung injury can be life-threatening, and it requires immediate medical intervention. And lastly, we have the delayed hemolytic transfusion reaction. So this type of reaction occurs days to weeks after a transfusion, and it's also characterized by the delayed destruction of donor red blood cells by the recipient's immune system. Delayed hemolytic transfusion reactions are typically milder than the compared to the acute hemolytic transfusion reaction, but they can also still cause symptoms such as fever, jaundice, and anemia. So in summary, erythrocytes are crucial for maintaining oxygen transport, and overall cardiovascular function, highlighting their importance in cardiac physiology. Also, understanding blood types and their compatibility is fundamental in clinical practice, especially in cardiac surgery and other procedures where blood transfusions may be necessary to support cardiovascular function and patient health. So, preventing transfusion reactions involves careful screening of both donors and recipients, proper blood typing and cross-matching, and vigilant monitoring during and after transfusion. Prompt recognition and management of transfusion reactions are essential to minimize their impact on patient outcomes. Here are my references. I hope you learned something new today. I definitely enjoyed researching this topic. I feel it's an essential topic that we all should study about, because if you have a family member or friend, anyone who needs a transfusion or a transplant, it's the understanding the importance of donor recipient compatibility, and I learned that, and I had a really fun time researching this topic. So again, I hope you enjoyed my presentation, and thank you for your time.